This is Dr. John Wycoff, and welcome to another podcast, I hope an exciting podcast, and Pathways to Wellness with Dr. John Wycoff. Today's topic is intravenous therapies, including intravenous vitamin and nutrient infusion therapy, IV EDTA chelation, NAD plus IV therapy, along with ultraviolet blood irradiation and ozone therapy. We're going to talk about all of those today in no particular order, because they're all treatments that we do each and every day at Wycoff Wellness in East Lansing. And I'd encourage you to get on our website and learn more about our IV therapies at wycoffwellness.com, wycoffwellness.com, or call us at 517-333-7270, 333-7270, 800-471-0455. Excuse me, 800-471-0255. I'm sorry, 0255. So today's topic, intravenous therapies. We're going to start out with just intravenous vitamin and nutrient infusions. You know, we've talked in other episodes about gut health, and oftentimes the gut health is so impaired, we cannot get the nutrients we need to our bloodstream. And that's a barrier that affects your health and wellness and ability to get healthy and for us to treat you. So with intravenous therapy, we bypass the gut completely. We deliver nutrients right into the bloodstream, so they're going to go to the cell. That's one advantage. Second advantage is that we can deliver high quantities of nutrients directly to your cells, much more than your gut would tolerate. So you might think that vitamin C is really good for you. Well, that's true, but high doses of vitamin C, very high doses, can actually be used to treat cancer, help immune function, and the types of doses we're talking, like 30 grams, 60 grams, 100 grams, would be impractical to take hundreds of tablets of vitamin C per day. Your stomach wouldn't tolerate it, you wouldn't absorb it, and you'd have a myriad of side effects. Yet we can put those nutrients in high concentrations directly into a vein and infuse it safely and effectively. So higher doses, better absorption, faster delivery to the cells can result in improvement of symptoms of chronic disease and allow you to transition then to an appropriate oral form to maximize your health and wellness. So a variety of health concerns, we'll talk about some of them as we go through the program today, help you feel better, give you more energy. So everyone is different. Everyone's individual. Everyone's gastrointestinal tract is different. But IV therapy can help with problems like dementia, anxiety, asthma, cancer, celiac disease, depression, eczema, hypertension, macular degeneration, neuropathy, scleroderma, and actually most autoimmune diseases, generalized toxicity, amyotrophic lateral sclerosis, ALS, arthritis, chronic fatigue, constipation, diabetes, headaches, immune disorders, multiple sclerosis, Parkinson's disease, shingles, vitiligo. So we can treat a number of issues with intravenous nutrients, and we have a number of infusions, we call them cocktails, of different water-soluble vitamins and nutrients that can stimulate your immune system, improve your energy, and we can begin that process almost immediately with an infusion. So don't be afraid to try an infusion or find a place that can do them for you. Certainly in East Lansing or in mid-Michigan, Wycoff Wellness is the leader in IV therapy. We do it every day. We do dozens of infusions per day. And we would encourage you to come see us or call us or look us up at wycoffwellness.com. Stop by at 1226 Michigan Avenue in East Lansing. We're right on the western edge of Michigan State campus, just west of Lansing at the beginning, or just east of Lansing and the edge of East Lansing, the west edge. But we have protocols that can help you get healthy and well naturally. We have infusions for energy. We have infusions for migraine headaches. We have infusions for cancer. We have infusions for immune health. We have a variety of infusions that can be made safely and infused relatively quickly We can do a typical IV infusion in probably 20 to 40 minutes, depending on the infusion and the caliber of IV, because infusing those nutrients directly can have a profound effect on your health. Now, we're going to try to customize that by encouraging you to get on a healthy Eating for Life program, continuing IV replacement, and then getting you on oral supplements. And we partner with a great company called Metagenics, and we will help design that program for you. So one of the things we're going to that we use IV therapy for is for cancer. We use a high dose of vitamin C, and one of the bugaboos of vitamin C is that you want a vitamin C that's made from a source that doesn't contain genetically modified food like corn. We don't like vitamin C from corn. We get our vitamin C from tapioca or beets. And the downside to those sources is that they're more expensive. But they're a much purer form of vitamin C, and they're not genetically modified like almost all of the corn is in the United States. It's been genetically modified, and it's not giving you the nutrition that you would like. So, IV vitamin C, it's just one therapy we do for cancer patients, and we'll talk more about that as the podcast goes on. Let's shift gears just a little bit and talk about NAD. NAD plus IV therapy. NAD stands for nicotinamide adenine dinucleotide. This is an enzyme that's found in all living cells and has been thought to be the anti-aging molecule because it's such an important role in our health and prolonging life. And NAD levels tend to decline as you get older. It's just a normal deterioration. But we see levels drop markedly in people with neurodegenerative diseases like dementia, Parkinson's disease, multiple sclerosis, memory issues. So oftentimes we're looking at those issues and recommending NAD, which can only be given effectively in an IV. You'll see oral NAD available. It's just not absorbed worth a darn in the gastrointestinal tract. So we either give it in an infusion or even in a subcutaneous injection. And that's an area that we will talk about just a little bit, is that many of these nutrient infusions can be given in small sub-Q injections. You can take home, get a package of them, and do them as often as you need to or recommended by us. We'll help you with those various infusions and injection paths and sub-Q injections we have. So NAD can be helpful for slowing cognitive decline, promoting healthy brain function, fighting chronic fatigue, improving energy, boosting metabolism, repairs and protects DNA, improves mitochondrial function. The mitochondria are the little organelles inside all of our cells that produce all of our energy. Enhances youthful vitality, regenerates cells, slows aging, reduces inflammation, improves neurological processes, aids in extracting energy from nutrition, helps preserve chromosomal integrity, aids in recovery from injury or exercise, and promotes physical endurance. So NAD is a great molecule. We've had really tremendous luck with NAD at Wycoff Wellness in East Lansing. We've used NAD for a number of diagnoses such as Alzheimer's disease, Parkinson's disease, dementia, heart disease, diabetes, mitochondrial dysfunction, mitochondrial energy disorders, multiple sclerosis, fibromyalgia, anxiety, depression, bipolar disorder, chronic fatigue, neuropathy, anti-aging, macular degeneration, memory, concentration issues. So NAD can be a powerful anti-aging ingredient. Some people just use NAD because they want to prevent aging. Who doesn't want to stay healthy longer? NAD can be used in that capacity too. You don't always have to have a disease to start on NAD. We do 2 types of infusion at our office. We have a 2-hour infusion and a 4-hour infusion. The 2 hours are more typical anti-aging infusion. It's great for anyone who wants to improve their overall health and wellness. If you have a neurodegenerative disease and want to regenerate from that system, like dementia, fibromyalgia, Parkinson's, multiple sclerosis. Oftentimes we'll do a 4-hour infusion. The only difference is you get twice as much NAD. We can only put in so much NAD per hour, do it safely, monitor you. But if you do have a significant neurodegenerative disease or chronic disease and you want to get healthy quicker, a 4-hour infusion may work better for you. We'll help guide you on that path. Everyone will see me before they begin an infusion at Wycoff Wellness. It's mandatory. You get a consultation with yours truly. We get the appropriate testing that we need, and then we design a pathway to wellness for you. That's what we do at Wycoff Wellness, and that's what we do here today on our show. Let's talk about EDTA, ethyl diamine tetraacetic acid. This is a chelator. EDTA is designed to chelate or bind. Chelate means to bind, like a claw, and allows you to take a fat-soluble substance, a heavy metal or a toxin, change it into a water-soluble substance that your urine can excrete. So we use this most often in atherosclerotic heart disease, hardening of their arteries, peripheral arterial disease, degenerative diseases in general, and even autism. ADD. Oftentimes there are heavy metals that have accumulated because of vaccinations that children receive. That's a whole nother topic, and we'll have to do a podcast on it. By the time that you're an adult in the United States now, you can get upwards of 90 plus vaccines if you follow the schedule. They start with hepatitis B vaccines when the child is less than 1 day old. And that's just an absurd thing. Yet that's what goes on in the hospitals today. So chelation is a way to pull those metals out of you, pull those toxins out of you. If you've had a heart attack or you have heart disease, if you have leg pain with walking, it's claudication. If you had a stroke or a family history of such, even if you've got things like gangrene, dementia, EDTA chelation may help you. It's safe and effective. It can prevent you from having surgery, but it's got to be done by a center that understands how to infuse EDTA effectively. If we're going to do a chelation therapy, we have to ensure that your kidney health is good, because your kidneys are going to excrete almost all of the toxins that are built up when we put EDTA into your vein. This is an IV infusion. We mix it up in a sterile bottle, a sterile poke into your vein, and then we infuse the EDTA at a rate of about 1 gram per hour of sodium EDTA. Calcium EDTA we can push in a little bit quicker, and we use that more in children who may have mercury poisoning. But if it's more for an adult with atherosclerotic disease, heart disease, we're going to use sodium EDTA. Just have to infuse it slowly. We have to make sure your kidneys are healthy. So the process we do at Wycoff Wellness on each and every patient, first we obtain a 24-hour urine collection. You obtain that at home. And then you come in with that urine collection in a bottle that we provide to you. We draw a blood sample, and we send that to a lab, and we obtain what's called a 24-hour urine creatinine clearance. The creatinine clearance is a measurement of your kidney function. We base the amount of EDTA we can safely give you on the creatinine clearance number. We're also going to get just a blood count and a kidney panel, liver panel, comprehensive panel, and then we're going to infuse the EDTA at a next appointment, the right amount over the right amount of time. Typically, initially, we're going to do a 3-hour infusion if your kidneys will tolerate it. And then we're going to collect your urine for 6 hours after you leave. We'll give you a container to submit an aliquot of urine afterwards, and we're going to measure what we pull out. We're going to compare that post-provocation urine collection to the pre-provocation urine collection, the one that we did as a baseline. And we're going to show you how much heavy metal load you have. So it's a little bit of a process, but that's how to do it safely. And if you find some places doing chelation with EDTA and not doing a 24-hour urine test, not doing an evaluation with a doctor with a blood test, then you need to run away and find someone like me, because we do it safely. We do it every day. We're going to see you initially, do a head-to-toe physical. We're going to do a history. We're going to get the right testing based on your history. We're going to schedule a creatinine clearance test. then schedule the right amount of EDTA and a follow-up urine heavy metal collection, and get whatever testing you need, whether it's blood testing, cardiovascular testing, Doppler testing, and help you customize a plan to get on that pathway to wellness. So EDTA is another great infusion that we do. It can be done very safely. It can be done in a controlled environment, and it can get you on that pathway to wellness naturally. Let's also talk about ultraviolet blood irradiation and ozone. We call this UBI, ultraviolet blood irradiation. This is a technique that started in the 50s and 60s with tremendous fanfare. It was actually used for end-stage sepsis and pneumonia and really amazing results. But at about the same time came the advent of antibiotics, penicillin and sulfa and sulfur medications, and all of a sudden UBI just kind of fell off the map. It's still provided by a number of providers across the country. UBI involves taking a small amount of blood, usually about 6 ounces, about half of this bottle of blood, which we do a phlebotomy, and passing it through a device where it's exposed to intense ultraviolet A and ultraviolet C, sunlight, the healthy wavelengths of sunlight. Ultraviolet A and ultraviolet C, we filter out the ultraviolet B, which is the more damaging spectrum of sunlight. We pass the blood through a device where it's exposed to the ultraviolet light, and the blood goes back into you. It's that simple. And UBI can really help you in terms of detoxification, improving energy, improving your oxygen carrying capacity. We use it to help with cancer fighting. We use it as one of our mainstream cancer treatments. Autoimmune disease, chronic fatigue, fibromyalgia, arthritis, is going to have a role in getting you on that path to health and wellness naturally. So the technique takes about an hour. There's very little downsides to it. There's no drugs administered. We put a small amount of heparin into the tubing to prevent the blood from clotting, but our technicians are very skilled and are able to get through the process, get the blood out, get the blood through the device and back into you so you can get the full effect of the infusion. We oftentimes add a substance called ozone to the ultraviolet blood infusion. Very simple to do. We have an ozone generator in our office. We use medical grade ozone generated from medical grade oxygen. The ozone machine, in essence, electrifies oxygen. It splits an oxygen molecule, O2, into plain old O's, just a singlet O. And some of those will combine to form something called O3. That is ozone. And O3 is not stable for a long period of time. It can be stable for up to about 40 minutes to an hour. So we're going to get that ozone gas administered and mixed with your blood and then administered into the IV to potentiate the effect of the ultraviolet light on the blood. So we use ozone for the same indications that we do UBI. Most of our patients now at our center do UBI with ozone. It's really the same procedure. There's very little cost difference in doing both, although some people still elect just to do UBI alone, and some people do ozone. I will sometimes do we call MAH ozone, major autohemotherapy ozone, because one, it's just very quick. I can do an MAH treatment in about 20 minutes. There's no time restriction on how quickly we reinfuse MAH ozone. We pull the blood out, we add ozone to it, put the blood back in. And really the only thing that rate limits that is the caliber of the angiocatheter we use to get the IV poke in your arm. So that can be done in 20, 25 minutes. With the UBI process, passing the blood through our cuvette, our glass tube, it's a quartz tube, slows the blood flow rate of return down. So it's going to take about 50 minutes to an hour. We can do UBI on anyone of any size. We are able to do a phlebotomy based on your weight. The bigger you are, the more blood you can give up. We can do it on children. We've done UBI on children probably as small as 5 or 6 for certain health conditions. So it can be done. They still have to have an IV, or if you have a port or a central line, a PICC line, That even makes it easier. We have the staff that is skilled to be able to access a PICC line and do a phlebotomy and then do the reinfusion. So a PICC line or a central line access through a port allows us easy access and ability to do a treatment. And we can do actually any of our infusions through a central line port or through a PICC line. So if you have that in place because of what you're being treated for, we certainly can use it. Some people just have poor veins. And fortunately, I have a really skilled phlebotomist at Wycoff Wellness. This is all she does is do phlebotomy or enter veins, and she can do it almost painlessly. I'm not the easiest poke to get. She can get me without any effort and does a great job, and I really seldom feel the needle even going into my skin. We always follow very specific universal precautions in our office, washing hands, sterile technique, prepping the skin before we enter the skin with betadine and iodine, not reusing needles. These are all basic things that seem just crazy to me that everyone doesn't do it, but yet I hear and see the patients every day that have gone to a clinic, even clinics locally, and have had really adverse effects from just really stupid things being done at other clinics. So, it's important that you go to a center like Wycoff Wellness that does IV therapies every day. We do IV vitamin and mineral therapy. We do IV EDTA chelation, both sodium EDTA and calcium EDTA. We do NAD infusions. We have a variety of infusions. We have an energy cocktail. We have a Myers cocktail. We have a migraine cocktail. We have an immune system, chronic fatigue, immune system boost. We have hair growth infusions. So if you're not sure if you have a problem that we can deal with, give us a call. We'll talk with you. We can give you an idea. We've got our common infusions listed on a brochure that you can get at the office, and we can help get you on that road to health and wellness naturally. We do iron infusions. Some people need iron to help them with iron deficient states. We can infuse a lot of iron into you safely. So let us help you. NAD is another great infusion we talked about. And we have a myriad of infusions that can get you on that road to health and wellness naturally. We want to get you on that pathway to health and wellness, and we want to do it naturally. This is Dr. John Wycoff. Please give us a call at the Wycoff Wellness Center. We're at 1226-1226 Michigan Avenue, East Lansing, Michigan. Our phone number, 517-333-7270, 333-7270, 800-471-0255, 800-471-0255, or look us up at wycoffwellness.com, WYCOFF wellness.com. Listen to our podcast. The library is increasing. Wherever you hear podcasts, just type in Pathway to Wellness with Dr. John Wycoff or Dr. John Wycoff. You'll pop up. You can see our podcast about functional medicine, methylation, detoxification. I've got interviews with Dr. Chi and Dr. Hotze, and just a myriad of information to help empower you to take the steps to get health and wellness, healthy and well naturally. Get on that pathway to wellness. This is Dr. John Wycoff.